I feel very privileged to sit on the stage with these people today, but I actually feel very privileged sitting in the room with everyone here because one thing that does make me sad is it feels like everybody who has spoken today has said the same thing, but we're still preaching to the converted, and it's the people in the room who are here. And when Dr. Simon Thaler said, you know, we are the people making the difference, we know that. How can we spread the word more? So hopefully the collaboration from today will enable us to really make change. And good luck, Antonella. So our panel today is Sophie Nunn, who is an OT at the Motor Neuron Association of WA. And then we also have Yasmin Naglazas, who's an adjunct professor, and Yasmin is the CEO at Parkinsons WA. We have Lenni Duffield, who is the CEO of Huntingtons Australia. They have recently just amalgamated as a national body. And we have Geoff Hutchinson, who's the client engagement manager from MSWA. So general theme amongst us as a panel is around neurological and movement disorder. So what I might do, which is very similar to the previous two panels, is just ask you all, and maybe Geoff, if we start on the other side,
Sure.
Just a quick little overview about your organisation.
Sure. So since starting in 1972, MSWA has grown to have a team of around 1,000 people who are providing support and services to people with neurological conditions, both in metro and regional areas. Our service model tries to focus on having someone also support for every stage of the journey, so from newly diagnosed with our nurses and counsellors through to ongoing services of both allied health and in-home and personal services and employment services through to higher care in our residential facilities. So we have 5 high care residential facilities, everywhere from Albany to Butler and in between. We also have 2 respite facilities, and we run 9 service centres which focuses on physio, hydro, outreach and a number of other clinical services. So we're also one of the leading providers of funding for neuro research. Over the last 10 years have been committed around 34 million towards neuro research, which has gone on really some great results. And we also run a little mega lottery, which some people may have heard about.
Lenni, do you want to give an overview of Huntingtons Australia?
Well, I'll quickly, probably Huntingtons WA, you've probably preempted, we will be officially merging 1st of October, so we are 10 weeks and counting, or 50 days for us who are counting. So I'm currently having the dual hat at the moment of CEO of Western Australia and CEO of Huntingtons Australia, so it's quite challenging, but I'll talk from a WA perspective, probably more relevance, obviously, for a WA conference. So Huntingtons WA was established 49 years ago, which is amazing, 2 years after MS, so in 1974, primarily from family founders. Huntington's disease is a rare disease, and so the impact is quite small across Western Australia and Australia more broadly. In Western Australia, it's estimated between 200 and 300 people have the disease, and then certainly up to about around 800 are impacted further widely than that. We provide a range of services from HD specialist practitioner side, and we have a cradle to grave approach. And we will support not only those who are gene positive with Huntington's, but gene negative or at risk. We support carers, families, those impacted, the medical professionals, the allied health professionals, those in specialised accommodation. So we look at the disease as a whole across the community and provide support. Recently, in the last year in Western Australia, we've moved into the NDIS scheme with all of its challenges, and we deliver services as well as coordinate support under NDIS. As an entity, in the last financial year, we supported 470 unique individuals in Western Australia, and we are a statewide service, though are limitations with resources. Obviously, hold us to Metro, but we do go down south and we do go up north as far as Kununurra and Halls Creek, and then offer obviously online via phone and the like. And that's us in a nutshell.
Great. Yasmin, do you want to have a chat about Parkinson's?
Can you hear me? Am I turned on? Yeah, that's right. Thank you. I've recently taken over as the CEO of Parkinsons WA and really enthusiastic about taking the organisation into the future, and really excited to hear about some of the challenges and the collaborative work that has really commenced in earnest in the neurological sector, I think, in the last 12 months. Charles Watson mentioned that this morning. But as far as Parkinsons WA, we're a little bit younger, we're 40. Next year, sorry. And we actually have an anniversary this year, 25 years of the specialised nursing service, which we will celebrate later in the year with a high tea. But I think it's sort of worth saying that most of the work that we do is contracted services for this specialised nursing service. It's a very highly specialised approach. And certainly we're looking at the model going forward and how sustainable that model is, and whether we need to broaden out to look at more value for money and to address the burgeoning demand for Parkinson's in WA and obviously Australia, but WA is our concern. We mainly have a metro service. We're funded for a metropolitan service. We have 5 nurses that address that need. Each of those nurses has up to 400 clients or patients on their books, and we service at any one time about 2,000, and they're not all active. We have a very much a wellness for life type model, and if our clients move into a stage where they can be self-managed, they've got enough in their toolkit to manage that, we pull away and get them to address that, rather than constantly creating dependency, which is not what the government wants to see, and that's very much underpinning what we will do going forward in a more pronounced way. So we do about 10,000 telephone consultations a year just in the metro area. We also have a country service which is funded by donations to Parkinsons WA, and that's about a third of the service that we provide for the metro area, and primarily focused in the southwest, but we are sort of moving out to Wheatbelt, Goldfields and Great Southern. We've got ambitions to work with the government and the neurological sector to address the needs going forward, and we need to really be positive and position ourselves as an organisation that creates that sort of value proposition for the government. We are a really highly energised team. We love what we do. We're passionate every day when we come to work that we want to make a difference, and I think that's the elements of a really great organisation going forward. So yes, we're like other organisations, perhaps not as old and not as big, but we're in the sector and we're really keen to collaborate with the rest of the sector.
Great, thank you. Sophie, do you want to have a chat about MND WA?
Certainly. I guess firstly, thank you very much to the Neurological Council for holding this event today. I think it's a big part of, we're all in the same boat and working together, and it's a fantastic organisation to be a part of. MND Association of WA, this is our 40th year, so it's twins. And we very much work with people with motor neuron disease, so that's sort of our primary and exclusive focus. So we work with people with motor neuron disease, their families and their caregivers throughout that MND journey, and very much throughout that entire journey, and beyond that in bereavement also for those people who are left behind in the wake of that. We provide physical, emotional and a lot of practical supports. And it's very much a holistic approach to caregiving. So we have 5 motor neuron disease advisors, one in the southwest region as well. And their role largely is providing emotional support, and they have a really good professional knowledge of person-centred care and certainly that person-driven care that we've spoken about earlier today as well. And they provide a lot of emotional support around that person and again their families and their caregivers. We have more recently expanded into the NDIS world, so we have 3 occupational therapists, myself being one of them, in the NDIS space, and one who works with the over 65s. We also have a respiratory physiotherapist, and we have 2 NDIS support coordinators. And I know there's been a bit of talk about support coordination and whether or not that knowledge is there within NDIS to acknowledge and meet the needs. But having support coordinators who specialise purely in MND has certainly been a big help, and makes my job a lot easier, having someone who understands those needs and can advocate at that NDIS level. We run a range of other services as well, so a lot of the things we do a lot of advocacy, we are certainly promoting a lot of research, and we run fundraising events throughout the year. Next weekend we've got our Unite Against MND Ball coming up, which is always a great avenue for fundraising, and all of these things contribute to our cause. To give you a bit of an idea, we've got more than 2,000 people in Australia with motor neuron disease. 200 of those approximately are in WA. The average life expectancy for someone with motor neuron disease from diagnosis is about 2.5 years. And in that time, the person experiences quite significant functional decline across all areas. So the ability to move, the ability to speak, to swallow, and eventually to breathe. And that's essentially the end stage of motor neuron disease is respiratory failure. So it's quite an insidious disease, has a big impact on the person and the people surrounding that person. And so we certainly strive to be at that point and provide that real wraparound service to provide the person the supports that they need throughout that journey. As I said, it's our exclusive primary focus, so very much underpins our mission to be the lead in specialist care for people with motor neuron disease. And that's certainly what drew me to the role. It's quite a unique position as an occupational therapist to work with just one unique disease process. That was really appealing to me, being able to focus, because that's what people with motor neuron disease need. They really need someone who understands that unique disease progression and what's required, so that they can have supports in a really responsive and timely manner.
Great. I might just give you a quick little overview of our organisation and what we do. So we started in 1967 with a group of parents who were looking for a cure for their children's conditions. At that stage, it was very much focused around muscular dystrophy, and in particular Duchenne muscular dystrophy. And one of the reasons for our name change was to become more inclusive. In fact, 43% of our community live with a neuromuscular community, not a muscular dystrophy. So it's really important that we are representative of the whole neuromuscular community. One of the things that I think we do best is we don't replicate services, and I think the biggest opportunity in the room is to have conversations and collaborate where we can, so that we don't replicate services. I think in the not-for-profit sector we're very good at that, because we only have limited money, so we look for opportunities for sharing. When Karen and Rachel were speaking earlier, you could just feel their love and connection for each other. And that is the most important thing I feel that as an organisation we do. We connect people who are living with neuromuscular conditions with each other. The greatest learnings that they can have is being on the journey with someone else who is going through the condition at the same time for them, with them. So our social programs are so vitally important for our community. And unfortunately, again, it's one of those, measurement of happiness is so underrated, yet we all live and our whole aim in life is to be happy, but it is a very hard thing to measure, and unfortunately doesn't necessarily tick the box for funding. But our role is really to fill the gaps in systems. So wherever there is something that's not provided, we try and fill a gap, or we link people to other organisations that can fill the gap for them. As an example, we link our community through MSWA for counselling. So, rather than us having to carry that as an extra person on our services, MS provide counselling for us. We link into the NCWA nurses who provide a lot of nursing support. We work quite closely with MND. We share opportunities where we can as an organisation so that our community needs are met. For us, the most vital thing is that person feels supported and connected. So, as was mentioned previously, they come along with a family. It's not just them. It's not just about providing the service to them as an individual. It's about being the wraparound for the whole family. And we think of ourselves as a family. We were started back in 1967 by Prof. Byron Kakulis with the focus of finding a cure. But we're so proud to be connected to the Perrin Institute, who are now a massive beast in research. And that is their role. And we as we're one organisation, and we split from the Perrin Institute to be able to provide that holistic care from the person, but we still integrate so closely with them in their clinics to make sure that the social support for the people through the Perrin clinics that have IBM and other neuromuscular conditions get that social support as well. So I feel like we've been all very repetitive the whole day about what we do, because we all do the same thing for our communities, which our communities need. And yes, there's opportunities for collaboration, but there's always a need for individualized services that have the skill for those individual communities. Who'd like to start and tell us about some of the major challenges that you face? Maybe, oh, there we go. Yasmin, you put your hand up. Off you go.
Well, I've just outlined 3 challenges because I think there's a lot of challenges in the sector that we've tossed around all today. But we, particularly with Parkinsons WA and probably more broadly the neurological sector, we're working within a model that's funded, but this model was established some 10, 15 years ago. So it's no wonder we're having difficulty in negotiating for outputs of service and attaching that to sort of outcomes and benchmarking, etc. So the department, and I know Simon Taylor spoke this morning, and then Charles Watson made a few comments afterwards about the sort of structure that's not in place at the moment. But there is a lack of macro policy around neurological conditions. I know we're looking at the main report, the IGAP report, but the reality is that there's not been a lot of attention to the neurological sector over a sort of a 10 to 12 year period since probably the networks were set up. And I know some of the networks in WA Health have done really good things, but I think that the health and neurosciences networks has not perhaps been capitalised on enough. So I think that the service model that we're dealing with and negotiating with the government for purchasing of services has been really difficult, and often decisions made around purchasing of services is not equating to a longer term plan, etc. The second area is the collection and understanding, the collective understanding of the data. So we've mentioned data quite a few times. We've made reference on a couple of occasions today to the small reference group that's been established as part of the broader neurological sector group. But this small reference group, one of the number one issues that they want to be in front of government with, or WA Health with, is actually what is the understanding of data in the neurological sector? What are we collecting? What are we collecting individually? And also what is the department making decisions on? Because we've got to get an understanding of that. That's the only way we're going to get real true value for money. The third area that I think we've got challenges is the link between the hospitals and the outpatient clinics. I mean, a lot of the work that we do is in the community, and we're very proud of that. Our clients and patients are not in a hospital very often, and when they are, it's because of a crisis. But we have a real community-based approach to what we do, and we rely very heavily on the discharge planning from hospitals and also the outpatient clinics that deal with our particular diseases. And so I think that the clinical pathways could be a bit better defined, models of care for each of our services, and I'll talk a little bit if we get another opportunity, maybe not, so maybe I better mention it now, but we have been talking in the sector and beyond with regards to a more generic model of neuromuscular type diseases and potentially a different model of care that looks at specialisation potentially later rather than earlier. Now, I think we need to tread warily on that, and one of the reasons that we're successful in each of our respective domains is that we have a body of expertise which is highly specialised, that the patient who is newly diagnosed can connect into straight away. They might only have 3 years of life left. In our case, Parkinson's, they could have 30 years of life left. And very active. So I think there's maybe a challenge for us to be at the table speaking about the more generic model at the expense of the more specialised service. And I'm sure there's a nice mixture, but we need to be at the table talking about it. Thank you.
Sophie.
Yeah, I guess I wanted to touch on two sort of points. One's maybe more M&D relevant and the other is perhaps applicable to quite a lot of the people here. So I've spoken about how the end stage of motor neuron disease is respiratory failure, and one of the few sort of treatments that actually has an opportunity to sort of enhance some meaningful life is non-invasive ventilation, so mechanical ventilation essentially. And a lot of people are wanting to have this at home, in their homes, in the community, which is a positive thing. It's keeping people out of hospital, it reduces hospital admissions, it can certainly improve quality of life, which is very much what our focus with this disease is. However, the effectiveness of this really depends on having access to very specialised equipment quickly and with the right supports to make sure that that's well implemented in the community, and that's something that's really falling short at the moment. So we're certainly noticing a growing number of people wanting to access mechanical ventilation at home, but the funding simply isn't there for it. So historically there's been sort of a range of funding from government and non-government, but it's all been sort of small scale and ad hoc funding. And it's created quite a complex process where there's these different avenues that people access funding through, and that funding's not been particularly reliable. So we're sort of wanting to close that gap and potentially look towards maybe like a state-funded single source of funding, potentially government funded, to be able to sort of fill that need. There's certainly been a lot of demand for a number of items of equipment through NDIS in particular, which isn't well supported through NDIS either. I'm sure that that's a whole nother discussion around some of the shortfallings of NDIS. But I guess one of the other issues we wanted to touch on was there's this huge discrepancy between the funding opportunities for people on home care packages versus NDIS. So to give an example, a home care package, level 4, which is the highest level, the maximum amount is $52,000 per annum. Compare that to the average spend of, say, an NDIS plan is near $250,000. So huge disparity between the two. And it sort of creates this lottery when someone's diagnosed, in that if they're over 65, they're not eligible to apply for access to NDIS. So that leaves them, they're deferred essentially to aged care funding. Disability is not normal ageing. So an aged care model is not designed to properly fund disability, certainly not complex needs such as those with motor neuron disease, who have this constant changing need. And keeping up with those equipment needs is quite difficult, and so we need better funding systems in place to enable people to have fast and flexible access to funding, and certainly not being discriminated based on someone's age as to whether or not they can access that funding in a timely manner.
I'll go. I guess from an organisational point of view, workforce, it's not new. As early as 2014, 2/3 of providers were suggesting that workforce is a critical issue, and that was before the NDIS really got started and this thing called COVID came along. It hasn't improved, but when you're talking about, supporting people with neurological condition, that consistency of staff and that understanding of their individual and their personal needs is so critical to good outcomes. So, finding good staff and retaining them is such a challenge at the moment, that's for us as an organisation, that's something that we're constantly trying to find ways of bringing people in, training them appropriately, and then making sure that they're staying. So that's the first one. The second one, I was going to echo the inequity between the different fundings, but what I will say is the complexity of the different funding is also a massive challenge for people with neurological conditions. I talk about NDIS on a daily basis and aged care on a daily basis. It's challenging, but for someone who's going to try and navigate this, that's really, really hard. To try and make sure that they get the right type of services, the right level of services, that they understand how to, navigate the different things, self-managed versus plan-managed versus agency-managed. It's a really, really, really complex thing. And it puts a lot of pressure not on the individual, but the carers and their families as well. And so trying to work with the NDIA or the aged care and just help them to understand the unique challenges that someone with a neurological condition will face in trying to navigate this funding is probably, a bigger challenge for us as a community, as a sector as well.
Lenni.
Perfect. I think probably 3 areas. I'm going to talk more broadly because I think most of everyone in this room has heard the certain challenges, but I'll probably speak at a more strategic level about challenges in the non-for-profit sector and then probably relate one more closer to home for Huntingtons. I think there's 3 areas that probably stand out to me. There's systematic government failure when it comes to funding, and I'll talk about that. The second one is access to services, which also relates to workforce. And the third one, I think, for particularly close to home for Huntington's is we're a rare disease, but we're an unknown rare disease, and we're one of thousands of rare diseases, and the challenge, that presents in operating in this space. I think the thing I'll start with rare diseases, and I'll end on the really juicy one of government failure for us all. I think being a rare disease is a challenge in itself. I think it's a blessing. We also see it as a blessing that not that many people are impacted, but it's always a two-edged sword. Those who are, it's even more of a challenge because there's less of them. And being rare, usually rare diseases are highly complex. I think there's a real challenge within the non-for-profit sector, in the neurological sector, is changing the status quo of a rare disease from being unknown to known, and I think collaboration can come in play when we're trying to move unknown rare diseases into a known rare disease. We'll never change a rare disease, they'll always be rare, but the challenge is to move it from being unknown to known. I think access to services is another one. If we look at neurological services or neurologists across Australia, Tasmania, a 2 to 3 year wait, and that's for a neurologist to fly in from Melbourne or Sydney to go there. They actually don't have a government-provided neurologist in Tasmania to deliver services. Queensland, up to a 2 year wait in Royal Brisbane, and they'll only service metro people. If you're regional, you have to go through a private practice. There is private neurologists in Tasmania, we'll say, talking particularly about the government system. And when we're talking about neurological diseases, we know that normally the individual and their family is financially impacted, and so their only choice is to access our public systems. And there is an expectation from the population that these services are a public good and should be delivered by the government and delivered at an adequate level, and they're just purely not when you say, a 2 to 3 year wait in Tasmania for a public neurologist to be flown in, a 2 year wait for a session, to see one in Metro Queensland, and if you're regional, just forget about it. There is a wait here, not as much, and we're really lucky, not as much here. Part of it is workforce. 75% of the workforce in the non-for-profit sector is female. And as females, and a percentage of those have caring duties and children and family duties and cannot commit full time. And so we've got those challenges on the top, and they're not new. So how do we deal with them? What does that look like? How do we challenge that? How do we encourage that workforce? We also don't have skilled workforce either. So there is actually not the neurologists in Australia to service either. So Caroline Orr, who's quite well known here, her mission coming in here was when she left, there was just one of her and she wanted it to be replaced with 5, and that was, I think, a great thing to try and achieve. So there's skill shortages as well. So it's not just not having the workforce and the challenges with 75% being female and those females having the caregiving role and the other role. It's They actually don't exist. And then trying to find them, correlates into housing issues, affordability issues, which brings me to systematic government failure. There's not one corporate entity in the not-for-profit sector, otherwise we wouldn't be non-for-profit. The government artificially influences the market price, and they do that by putting out to tender, and it's not new. And we know that when we go out to tender, if you actually put in for the tender for the price it costs to deliver an adequate service in Australia, the government wouldn't buy it because they believe it's so cost prohibitive. That's why corporate isn't in our sector, because corporate are there to make money. So is a non-for-profit. As a non-for-profit, if we don't make money, we're insolvent. So we are systematically only probably funded for 75% or less of the actual cost to deliver services. And if government truly were representative, we'll take the current increase in the SHADS award right now of 5.7%, but most indexation of either state or federal government contracts only went up between 3 and 4.5%. We've already got a deficit of 1.3% or 2.3% in covering those costs. So we now need to ask more for fundraising or deliver more or charge for services for our client base who are already financially impacted because of the burden of disease that they have or the injury that they're covering. So I think there's a great opportunity in a collaborative space to do more active engagement with the government about true cost of services and what it costs, because every non-for-profit is impacted by SHADS awards, or awards, increases in rent, increases in electricity, increases in phone, telcos, service provision, and yet the indexation on our contracts has been stagnant for more than 10 years, more than 20 years, and our CPI hasn't actually matched what it looks like. So I think there is the really frustration for me is we are a wealthy country, we're a wealthy state. We should be looking at arguing more to actually have neutral cost recovery on services, like the expectation is when the government contracts out to do a building or a commercial premises, or a service for cleaning or the like, or any other commercial-based service, it is cost recovery neutral. They don't sort of cut the corners in that. There should be no expectation in the non-for-profit sector that we do the same.
Thanks, Lenni. I think you've really hit a nail on the head there, which I think we've all, it's always really hard as in the not-for-profit sector to come up here and talk about what are the challenges and not say money's a challenge, because it's like, they're going to say it's money. It is. It's always going to be a challenge. And, as a non-funded, not-for-profit charity, non-government funded, it's really hard, and you have to maintain your workforce. You then go to part-time models, you go to whatever you can to make ends meet. For our community and for the neuromuscular community, absolutely, and as an organisation, everything's been covered. There's just one thing that I thought I could add without rehashing, was one of a significant struggle for our community is transition services from paediatric to adult. When I started my job 8.5 years ago, the very first I went out and I just spoke to the community. I met with 50 different families, and so many of those families were transition, and I go out regularly and speak to families, and that transition care where you really nurtured within the paediatric environment, and for someone who's living with a really complex condition to move into the adult environment where the expectation is that them as an adult then take on their care and just do it on their own, it's really tough. So that's just one extra, challenge that I see that our community face. We're here to be optimistic, and we are the passionate people that care. So I think there's so many opportunities. Just being in the room together is an opportunity. Perhaps we can very quickly, because I know it's nearly afternoon tea, quick wrap up of what do you see as the opportunities?
Well, I just want to say that I think that the government, WA Health, feels that the neurological sector is a Pandora's box, and once they open it up, the costs are going to be massive. So I think there's a wonderful opportunity for us to work proactively and very innovatively. I mean, I've been out of the sector for about 20 years. I've come back in, not much has changed. The decision making around funding and purchasing of services is about the same. So there's a wonderful opportunity. I was only speaking to my board last night to be at the front of the curve as a sector and go to the government with models that work, models that offer value for money, and models that can be, we can manage, and they're going to look a little bit different to what we've got today. I did want to say that a couple of opportunities were capacity building in aged care. I think there's a lot of people in aged care with neurological disorders, particularly Parkinson's, that are not having a good environment. Just simple things like medication management is not done very well at all. And for us, particularly at Parkinson's, one of our opportunities is to extend the toolkit that we have for our patients and clients to make sure that they are self-managing. And we're very interested in the early diagnosis, and it goes across the board with all neuromuscular disorders. When a person is newly diagnosed, they should hit the ground running with what I call a welcome pack. It's not really the right wording, but they should know what services are available and how to navigate the system almost immediately, because if they've waited 2 years for a diagnosis, they're going to be in need of that. So there is some timing issues around getting our patients and clients ready for the journey ahead, whatever that might look like.
I think there's a real opportunity collectively to change the funding model for non-for-profits more broader than the neurological sector. Non-for-profits deliver 70% of Australia's public goods: hospitals, education, university, roads, recreation, childcare, family childcare, daycare-based activities. That we've got a real opportunity to collectively work to change that funding model, because if we all start to pull back and only deliver a cost recovery model of what we're funded, there'll be a huge gap in the market, and that will impact every Australian. So I think there's a real opportunity to look more broadly to change that funding model and how non-for-profits are funded, which will not only impact my organisation, but MS, Parkinson's, MND, everyone in this room, where we actually start to be a real collective voice in challenging how contracts and certainly procurement and funding of those contracts, and a voice for the 70% of public goods that we do deliver.
Conscious I'm standing between us and coffee, so I will be quick. Data, it's been mentioned many times, but it should not be underestimated how much of a destructive environment we've been in for the past few years. So being able to work together to identify what is a baseline, what works, what doesn't work is really, really important. Training. So many people today have talked about the importance of understanding the different neurological conditions and how that comes into service delivery. Working together to lift best practice of what good service looks like, good training looks like. I think that it's a really challenge for any organisation to get their training right. So being able to work together as a sector to really kind of lift the general knowledge of what good service within the neurological sector looks like, that would be really, really great. And just to kind of piggyback on yourself, looking at other sectors and the way that they've responded to government and how they've got together and spoken with one voice. I think when things happen, we all speak up, but we speak up as individuals. Speaking up as a collective and making sure that not only the government but the wider community who's able to then put pressure on the government to bring about the changes that we're talking about here, I think that's a really big opportunity for us to really work together to bring about the changes we've all been kind of talking about today.
I guess I'd very much share that same sort of sentiment, establishing a stronger neurological voice particularly within NDIA, if I'm being a bit biased as a therapist, but establishing a better understanding of progressive neurological conditions in particular, and the need for sort of fast access to flexible funding. I think establishing that voice, it's up to us to create that sort of community of practice, and that really needs to be informed by the people that are in this room, to really be lobbying that the voice is heard at those levels, particularly for me around with NDIA. so that those decision makers have more of an advisory and sort of consultative structure to them, so that they can better meet the needs of people with neurological conditions.
Great. I echo all of your sentiments, and I think, you know, one of our biggest opportunities is data, and getting access to that data is probably the most important thing, because that data is there. It's just that we don't necessarily always have access to it. But we cannot underestimate the importance of the patient voice and the patient being part of the solution. So our community have to be part of this conversation. It can't just be, you know, we have to have that representation so that government understand the impact on the individuals. Every single one in this room is here connected through either your job or living with a condition or passionate about, and it's because of people. And, you know, everything we've spoken about is about people. So we have to keep that connectedness together and making sure that it matters. We've got to have that collective voice. So thank you. I'd like you to join me in thanking the panel.